The human brain remains one of the greatest mysteries in science and one of the greatest challenges in medicine. The NIH's BRAIN Initiative is funding research that's beginning to unlock those mysteries. John Ngai is the director of the BRAIN Initiative. John, welcome to the program.
Thanks so much for having us.
You've been director for 2 years now. What's the genesis of the BRAIN Initiative at NIH? Why was it created?
So there was a recognition that that we just don't have the tools yet to understand how this remarkable organ in the body works. The human brain is the most complex organ in the body, arguably the most complex thing that we know about in the natural world. The human brain comprises about 86 billion with a B nerve cells or neurons, about twice as many other cells. Together, they make up the circuits that process information for us, that are responsible for sensing our environment, moving our limbs, emotion, consciousness, cognition. How does that all work? We just don't have the tools to understand that. So the mission of the Brain Research Through Innovative Neurotechnologies, or BRAIN Initiative, is to develop these tools that will revolutionize our understanding of the brain in both health and disease and ultimately lead toward cures.
So there are a lot of researchers around the country and around the world studying the brain. How do you leverage all that knowledge and disseminate it to really advance the field?
Yeah, that's a huge challenge. I mean, since the initiative started funding its first awards in 2014, we've funded over 1,200 projects. The investigators have published over 5,000 papers, generated a ton of information, a lot of technical resources. This is a huge goal. We are working very hard to make sure that this knowledge gets out there for the benefit of all. We are leveraging teams not only across the country, the US, huge talent in the US, but also across the world. So we've stood up some really big projects. Some of the impacts we've had in the BRAIN Initiative is not just the resources being generated. We're also seeing immediate impacts in the clinic in first-in-human trials that are now being scaled up. But very importantly, we're learning how to do big team science. There's some projects that just require lots of effort to generate resources at scale, and we're really doing a good job of doing that. It's a great lesson for how to conduct science to have a big impact right now.
So I want to ask you about real-world examples. You were talking about clinical trials, and ask you first about your research into movement disorders such as Parkinson's disease. Have there been any progress made on that?
So there's been some progress in a couple of domains. Let me talk about immediate-term impacts first. Some of you may be aware of deep brain stimulation, which has been around for decades, which has been used to stimulate different parts of the brain for patients with Parkinson's disease, other movement disorders. And it's treating symptoms, it's not treating the cures. It's been around for a long time, but right now we have some BRAIN Initiative funded investigators that are really making some advances with that technology to make it better for the immediate term in so-called adaptive, what we call adaptive DBS. It's actually literally reading out the aberrant activity in the brain together with aberrant movement and fine-tuning the stimulation to control that. So that's really amazing. What's really more amazing is if you consider mood disorders. I mean, mood disorders like treatment-refractory depression, OCD, PTSD, there's really no cure or treatment for these conditions, partly because they vary from individual to individual. We don't know which circuits in the brain are misfiring during these conditions and when patients are in crisis. And for many patients, it really is a life or death situation. And right now we have a couple of research groups out there that we're supporting that are able to use the information that we have now about how circuits are functioning in the brain. They're doing long-term recordings to measure the activity in these circuits. So they're really literally reading some of the activity in the brain that correlates with whether the patient's in a good state or a bad state, and fine-tuning the stimulation with DBS electrodes that actually shifts patients from a bad mood state to a good mood state. So this is really incredible. For me, this was science fiction 5 years ago, and now we're seeing a possibility for treating people who have no other hope. And again, we're trying to scale that up. And as we learn more about the circuits that underlie these conditions, we'll be able to develop more precise therapies. There's a lot of machine learning and artificial intelligence that's going into reading out these, what we call biomarkers, and getting into more effective therapies. Ultimately, we'd like to move these into molecular and gene therapies, but that's a bit further off in the future.
And you know, when we talk about research projects in the medical field, The question always arises about ensuring race and gender equity in those projects. Are you looking at that, and how do you ensure something like that?
We absolutely are. And we're looking at this in a couple of different ways. One is that in the projects that we're funding, we keep a very close eye on the ethical, legal, societal implications of what we're doing. And again, if we cannot develop these new tools and new treatments for the benefit of all, we will have failed, right? So this is something we need to keep front of mind in the very beginning, not kind of decided at the end. So we're building that into how we look at this. We have a working group, a group of external advisors that helps us look at these issues. It's called the Neuroethics Working Group. Another way that we look at this is by, well, who's doing the research to begin with, right? I mean, what we study, who we help is ultimately determined by who's doing the deciding. So we're making a concerted effort to make sure that we have diverse perspectives at the table when these research projects are being designed. This happens at the level of the investigators themselves, but also on the part of the folks at NIH who are actually looking at these projects too. So we also have to keep in mind, there's a huge diverse talent pool, not only in the US, but across the world. And we need to leverage all the talent we can to solve these incredibly complex problems. So this is how we're approaching this effort.
All right. Thank you so much for being on the program. Nice to talk to you.
Thanks so much.
Thanks for watching. If you enjoyed the video, give it a thumbs up and subscribe to our channel so you don't miss out on any future Government Matters interviews.